All surgical procedures should be sent home or emailed the surgical options forms. It consists of 2 pages or one two-sided page. It discusses blood work, that all surgical patients, anybody going under anesthesia, should be having blood work. This does ensure, as it says here, that we do not have any organ disease, which the main organs that we are testing for, liver and kidneys, have a lot to do with flushing anesthesia out of the system. So that is very important to know ahead of time to reduce the risk of anesthesia, that we are having proper organ function.
So do you read this out loud to them?
No, I just paraphrase it. Yeah.
Okay.
IV fluids we always give as well during procedure. That helps maintain blood pressure, which always goes down during anesthesia. So that really helps protect the kidneys. It also helps flush anesthesia out of the system faster. So again, helping the pet wake up faster, get that anesthesia out of their system as quickly as we can. Antibiotics are always done for virtually all procedures as well, anytime that there is any surgical incisions. There are 2 options of type of antibiotics to be given. One is the basic, which is a 24-hour penicillin injection, and then they go home with antibiotics that usually last about 10 days. The other option for pets who are hard to medicate at home is an injection of antibiotics that lasts 2 weeks. Most cases, the doctor is accepting to do this type of an injection.
Convenient.
The convenient injection, yes. Very rarely does he say that no, the infection is such that we have to have an oral antibiotic. So most of the time we can choose this. However, there is quite a cost difference. So especially on large breed dogs, it is based on body weight. So large breed dogs, normally you can hide a pill in a piece of meat or cheese, but we have had people that don't want to deal with having to give the antibiotic at home, or they do have the dogs that are difficult to pill. So that is always an option for everybody as well. Pain relief is always done with any kind of surgical procedure. We always give a pain relief injection and send home either some tablets for a few days or some liquid, which is usually easy to give for a few days. The antibiotics are always done with the procedures as mentioned above here. Even for dentals, doctor usually will agree that Convenia is an okay antibiotic for whatever is needed for the dental extractions. Rarely he will say no, again, that mouth is such that we have to have orals, but that would be up to doctor's discretion. But again, normally he agrees that Convenia is an acceptable antibiotic for that. Our second page is just verifying that we are up to date basically on rabies. Rabies is our only vaccine that we require for surgery, for safety of personnel as well as for everybody in the hospital. If we are not current on rabies, we can give it morning of the procedure, but ideally we would give that beforehand on a previous visit. Other vaccines, if they are due, we can give at recheck time, which is in 10 to 14 days. But normally, doctor does not like to give all these vaccines at the same time the pet is being anesthetized, rabies only. Surgical laser is required for all non-elective procedures, which by non-elective I mean any mass removals, dental or anything of that type. The only thing that are basically considered electives are spays and neuters. So anything other than a spay or neuter will have laser, and there is additional fee for that as well. Spays and neuters, it's a good idea to have laser. It does cauterize small blood vessels as it cuts, as well as deadens the nerve endings, so they do have a little less painful recovery, and so it is nice to have laser, but again, it's not required for spays and neuters. And of course not used in dentals. Pardon?
They also have less swelling.
Yes, less swelling and less, just an easier recovery in general. 2 types of anesthetic that we have available. We have isoflurane and sevoflurane. Both are very good gases. Isoflurane used to be gas of choice until they invented sevoflurane. Now sevoflurane is used exclusively in human hospitals. We do have the ability to use it here as well. With the sevoflurane, they go to sleep faster. They wake up faster as it's more quickly disseminated by the body and the organs. And so they also do wake up not only faster, but less anxious because they don't have that one phase where they're a little confused. We actually did have a nurse patient of ours who was under anesthesia for both, and she did tell me that under isoflurane, she woke up, she had a headache, she didn't know where she was, and then when she woke up with sevoflurane, it would have been like she had just taken a nap and she was ready to go home. So kind of the difference from a human perspective. From organ-wise perspective, again, for patients that are over 8 years of age or older, it is more quickly gotten rid of by the body, so easier on the organs as well. However, the same size gas anesthesia does cost us about 8 times as much, so we do have to pass a cost along a little bit. So it would be an additional $49.50 for that type of anesthesia. Microchips are just offered to any pet who's sleeping just because it's a larger needle. And so for the comfort of the pet, we just try to offer that and remind people when they're sleeping that's a great time to do the microchip. Anything additional that is wanted, which is nice to do when they're sleeping as well, so the pet doesn't have to be stressed out by it while they're awake. Nail trims, ear cleanings, ear pluckings, anything like that, we could do as well. You just let us know what you would like us to do.
Excuse me, Carol.